Hello, everyone. Thank you for joining us today. Welcome to today's talk on COVID-19 vaccines, what you need to know to protect yourself, family, and community. Before we begin, allow me to go through some house rules. So firstly, if you have any questions regarding the topic, please type them in a Q&A platform. We will answer them during the Q&A session at the end of the talk. For other miscellaneous inquiries that are not for the Q&A session, please type in the chat box. Please also fill in the survey form at the end of the session to help us do better. Please do not leave the Zoom immediately after the session ends today, as we will be sharing more information about another upcoming health talk. We will also be asking for your feedback regarding today's sharing. Lastly, please note that the slides will not be disseminated after the session. If you have further inquiries regarding today's session, you can email ttshpharmacyweek@ttsh.com.sg or speak to your healthcare team for more information. Today's session will be recorded and uploaded onto our TTSH Health Library and TTSH YouTube channel. Today, we are pleased to have with us Mr. Gavin Chia, Senior Pharmacist at NCID Pharmacy. Mr. Chia will be sharing more about how our immune system fights COVID-19 infection and how the various vaccines can protect us. He will also be touching on familiar topics you might have heard over the news, like the antigen rapid test kits, also known as ART kits, and the home recovery program launched by Ministry of Health. There will be a Q&A segment at the end of the session, so please feel free to type in your questions into the Q&A function so that we will be able to address them later. Without further ado, I'll now pass the time on to Mr. Chia. Mr. Chia, please.
Hello, hi, afternoon, everyone. Welcome to this talk, spending your afternoon with us. My name is Gavin. I'm a pharmacist at the National Center for Infectious Diseases. And today I will briefly share with you on a very hot button topic right now on COVID-19 vaccines and a little bit about the antigen rapid test kit. Before we start on vaccines, right, we will need to know a little bit about our immune system. So basically, when the SARS-CoV-2 virus attaches its spike protein on the cell membrane, it will be absorbed into the cell and it will trigger an immune response. So there are a few components of the immune system without going too much into details. So this is actually the plasma cells. So plasma cells in the immune systems is the one that produces antibodies. And these antibodies are the ones that will attach to the SARS-CoV-2 virus to neutralize it. So SARS-CoV-2 virus is the causative agent of COVID-19. Okay, there are also T cells, for example, T helper cells, and cytotoxic T cells, which are not in this diagram. So cytotoxic T cell is another arm of the immune response that will actually destroy the infected cells with SARS-CoV. So antibodies don't last forever. Some of the plasma cells will then become dormant in the body as memory B cells. As you can see over here, this memory B cell stays longer in the body. And when you are exposed again to the SARS-CoV-2 virus, it will rapidly produce antibodies to fight off. Okay, so so B cells and T cells are components of the adaptive immune response, which helps your body to fight off COVID-19. And vaccination is supposed to trigger these immune cells in order to better protect you from COVID-19. There are many different kinds of vaccine. Of course, we are very familiar with the RNA vaccine. These are the newest in the market. There isn't any RNA vaccine before COVID-19. So these are the Pfizer BioNTech vaccine and the Moderna vaccine. There are other forms of vaccine, such as the viral vector vaccine, in which an adenovirus, this is basically a harmless virus, harmless common cold virus, which packs the genetic material inside of SARS-CoV-2 and is delivered into the body, such that the body can then use this genetic material to produce proteins, and the immune system can recognize it and mount a response to it. So the vaccines that use this particular technology, the viral vector vaccine, for example, would be the AstraZeneca vaccine. While another vaccine from China, Sinovac vaccine, is an inactivated virus vaccine. This means that the vaccine actually contains the actual SARS-CoV-2 virus, but it has been killed, such that it no longer is able to infect the cells, but the proteins are still intact, and therefore the immune system can recognize the proteins and mount the appropriate immune response. Okay. So I will just briefly touch on the differences between the Moderna and the Pfizer vaccine. As you can see, both are very efficacious, above 90%. The Moderna vaccine needs to be given 28 days apart, that is 4 weeks, while the Pfizer vaccine is 3 weeks apart. And one important thing is that the Pfizer vaccine can be used for children, for teenagers between 12 to 18 years old, while the Moderna vaccine so far is only licensed for those above 18 years old. Okay, so how do mRNA vaccines work? So before I start, I need to clear the common misconception that I've heard also, that mRNA vaccines might alter your genetic material. So this is actually not true. mRNA vaccines do not change your cell's genetic material. mRNA is actually, or is short form for messenger RNA, is part and parcel of the genetic code in your body. What happens is that it is a messenger that translates into proteins. And after that, this messenger is actually destroyed. So it doesn't insert into your genetic code in any way. So you don't need to worry too much about that. Okay, so what it does is that the mRNA contains the genetic material of the SARS-CoV-2 virus, especially the spike protein, as you can see over here. This is a spike protein. And your body then uses this information to produce the spike protein in your body, which your immune system can recognize, and therefore produces the antibody and cytotoxic T cells towards this spike protein. So there are two mRNA vaccines in Singapore's National Immunization Program. There's the Pfizer-BioNTech vaccine and the Moderna vaccine. Okay, so how effective is the Pfizer-BioNTech vaccine? It's important to just know that both vaccines, Pfizer-BioNTech and Moderna, still has very good protection against severe disease and hospitalization. So I've arranged the timeline on the left-hand side. You can see that with more and more variants, different variants, especially now the Delta variant coming out, the effectiveness against infection may drop. For example, in a study from New York in August, it actually shows that the effectiveness against infection drops to around 80%. However, if you look at effectiveness against severe disease, it is still very high. So the vaccines are still able to prevent severe disease, ICUs, and hospitalization. Okay. Okay, so if you do contract COVID-19 and you have the following underlying conditions, you're at a higher risk of progressing to severe disease. So if you are in the elderly group above age 65 years old with cardiovascular disease, lung disease, sickle cell disease, which is a blood disorder, or if you have chronic conditions like diabetes, cancer, if you're obese, if you have kidney conditions, or if you're a pregnant mother, you're a smoker, or you have received any kind of transplant or taking any immunosuppressive therapy, you are at a higher risk of developing severe COVID-19 COVID-19 disease, and you are therefore highly recommended to actually take the vaccine to protect yourself. Even if you are young and you do not fall into these higher risk groups, recent studies have also shown that the COVID-19 vaccine can actually help to reduce the chance of getting long COVID by about 50%. So there are still a lot of advantages of taking the vaccine. So what is long COVID? Just one slide to explain what it is. It's basically symptoms of COVID-19, which extends more than 12 weeks. Sometimes it can last a few months. And these symptoms include tiredness, shortness of breath, heart palpitations, chest pain, problems with memory or concentration, or what they term as brain fog, changes in your taste and smell, or joint pains. And we do not exactly understand what causes long COVID, but it could be due to the immune system working at its limit, where the immune system attacks both the virus and also healthy body tissues. And the likelihood of actually getting long COVID actually increases with age, and it occurs more commonly in women. So no matter whether you do have conditions that predispose you to severe COVID or not, just take the COVID-19 vaccine. Okay, so Moderna vaccine is also very efficacious. As you can see, efficacy against infection above 90%, and it's also highly effective against severe disease. I will briefly talk about how Sinovac vaccine works, because there's a small proportion of the Singapore population who actually received the Sinovac vaccine. So like I mentioned earlier, it's an inactivated vaccine. What happens is the SARS-CoV-2 virus is actually killed. So therefore, it is being inactivated. It's in the second picture here. It's being inactivated, so it can no longer infect your cells, and it's injected into the body. So your immune cells, as you can see, this is the antigen presenting cell and the helper T cell, which is part of the immune system, will recognize the dead virus, and it will mount an immune response. So it will produce antibodies. So these Y-shaped things are the antibodies, and these antibodies will be produced against the dead virus, okay, such that when you actually encounter the real virus subsequently, these antibodies are ready to react to the live virus, okay? So how effective is the Sinovac vaccine? Again, the Sinovac vaccine mostly has real life data from Indonesia, where it's widely used, and also in Chile. Again, the effectiveness against infection is also quite good. However, from Chile, it's actually reported that it's only 58.5% effective against infection. But the important thing, again, is that it is very effective against severe disease, above 90% against hospitalizations and deaths. Okay, 89.7% against ICU admissions. So the vaccines do protect against severe disease. So who should then receive the vaccines, right? Since it is such a, I mean, there's a proven protection against severe disease. Who should take it? Almost everyone can take the COVID-19 vaccines, the mRNA vaccines. Even patients who have transplant surgery or who are on immunotherapy can get the vaccine, but we do recommend that you actually consult your treating specialist before you proceed to take the vaccine. Or those with anaphylaxis to any other medications, food or insect stings, or those with multiple drug allergies can now actually take the vaccine. All right. This is actually updated because as we know, when the vaccines first came out in early this year, the persons with multiple drug allergies, they are not eligible to take the vaccine, but this has been updated. Okay, also patients who have cancer but not on treatment, they can receive the vaccine. Or those who are on active treatment, you will have to consult your treating oncologist before getting the vaccine. Patients who have recovered from COVID-19 at least more than 3 months after, we still recommend 1 dose of the vaccine to further improve your immunity. And persons with chronic conditions, high blood pressure, high cholesterol, diabetes, this will be recommended. Or conditions that can harm the immune system, such as HIV, you can also proceed to take the vaccine after consulting with your treating physician. And pregnant breastfeeding women who are in the high-risk group should take the COVID-19 vaccines. But if you are a child below 12 years old, currently there are no licensed vaccines, so you cannot take it. Or if you have allergic reactions to any mRNA vaccine or its components, then you cannot take it. But then you can proceed to take non-mRNA vaccines, such as Sinovac. Or if you have myocarditis, which I'll explain later, after the first dose of the mRNA vaccine, then you should not receive the dose again. Some people might be interested, maybe some of you are regular blood donors and you are interested to know if you can donate your blood after your vaccination. So HSA has actually come out with an advisory. if you're injected with the mRNA vaccine or the inactivated virus vaccine, such as Sinovac, and you do not experience any side effects or very localized side effects, such as muscle ache at the injection site, you can take your you can donate blood 1 week after vaccination or 1 week after side effects has resolved. But if you have generalized side effects such as fever, generalized muscle pains, rashes, or lymph node swelling, then you should take it 4 weeks after the side effects have resolved. For all other vaccines, HSA recommend only to donate blood 4 weeks after vaccination or 4 weeks after the side effects have resolved, whichever is longer. Okay, so there have been reported cases of myocarditis, which is actually inflammation of the heart muscle, or pericarditis, which is inflammation of this fibrous sac surrounding the heart in patients who take mRNA vaccines. Is very rare, but the symptoms include chest pain, shortness of breath, or abnormal heartbeats. So therefore, MOH has actually recommended to avoid strenuous physical activities 2 weeks after receiving such vaccines. Do take note that it's adolescents and men below 30 years old are at higher risk of myocarditis after mRNA vaccination. So some of the strenuous activities to avoid will be swimming, lifting heavy weights. As we are well aware, there's a case report in the newspaper of a teenager who had myocarditis after lifting very heavy weights. But you can do housework. Yeah, that is actually a safe physical activity. So these are the commonly reported adverse effects for the mRNA vaccines produced by as reported by HSA. So as you can see, rash is the most common adverse effect, followed by angioedema, which is swelling of eyelids, face, and lips. These are allergic kind of reactions. And you can see all the other reported adverse effects. These reported adverse effects are generally very few, considering that we are actually injecting millions and millions of doses. So it's actually rare. Okay, so in Singapore, as of 25th September, which is a few days ago, Singapore has actually achieved a very high vaccination rate, where 85% of the population has received at least 1 dose and 82% has completed the full vaccination. But as we are well aware, we are now in the middle of a wave, COVID-19 wave, and so we can see that from data produced by MOH, more people are actually in the hospital right now as compared to maybe 1 or 2 weeks ago. However, out of all the total infections in Singapore, actually 98% are asymptomatic or those with only mild symptoms, while around 1.7% they might require oxygen supplementation, and only 0.2% will end up in the intensive care unit. Okay. So this is the graph of the epidemic, the epidemic graph of the situation in Singapore. And this is not updated yet. As you know, yesterday we actually hit above 2,000 cases. So now it's time to think about booster shots. Okay, looking forward into the future. In fact, now MOH has actually recommended booster shots for elderly above 50 years old. There are multiple considerations for booster shots, whether you should take a booster shot with the same vaccine or with different vaccine. And there have been multiple papers published. However, this is still data that is evolving. So currently, if you actually receive the SMS to go for your booster shot, you should seriously take up the booster shot to increase your immunity. Okay, so these are the plans for booster shots in Singapore from September onwards. Currently, for those above 50 years old or those who have immunocompromising conditions, where 2 shots of the COVID-19 vaccine may not offer sufficient protection or due to waning protection, the 3rd shot will actually increase your immunity, and you're highly recommended to take it. So will booster shots be needed in Singapore? And I would like to draw a parallel to another country that is similar in its vaccination journey, like Singapore, like Israel. So Israel actually vaccinated very early on, same like Singapore in end 2020. And you can see that after vaccinating a high proportion of the population, the cases actually dropped and they remained very low for a few months. And there was a recent sudden surge in cases, similar to what Singapore is experiencing. So this sudden surge in cases could be due to waning immunity in the population. It could be due to the Delta variant, which the Delta variant, which actually reduces the effectiveness against infection and is more transmissible. So based on Israel's experience, it is very likely that Singapore will need booster shots to actually suppress future waves of infection. So what is the Delta variant? Okay, this is just a little bit on the what we call the variants of concern or variants of interest, as defined by the World Health Organization, WHO. So COVID-19 is a virus that will constantly mutate and will constantly evolve. There are certain mutations which are beneficial for the virus and certain mutations that are detrimental to the virus. So if the virus is able to acquire multiple mutations which are beneficial to it, it might be able to transmit further and also might be able to evade certain medications as well as vaccines. So variants of interest are viruses or COVID-19 viruses that have genetic changes which increases its transmissibility, which means it's able to spread faster, or increases its severity, or reduce effectiveness of vaccines detection or treatment, and is causing significant community transmission of multiple COVID-19 classes in many countries. This will be classified by the WHO as a variant of interest. A variant of interest can be upgraded to a variant of concern if there are following changes with effect on global public health. Whether there is an increase in transmissibility, which means it can spread very, very fast like the Delta variant, or increase in virulence, more severe variant, or it actually decreases the effectiveness of all the public health and social measures available, such as safe distancing, or maybe vaccines or therapeutics, then it will be considered as a variant of concern, which of course we should be concerned about. So currently, there are 4 variants of concern recognized by the WHO, the Alpha, Beta, Gamma, and Delta variant. And the current variant that's sweeping across the world is actually the Delta variant. This was designated as a variant of concern in May 2021 by the WHO. The WHO is also monitoring up to 5 other variants of interest. I will not go too detailed into it, but the latest variant to be added into this watch list is the Mu variant. This was actually added on 30th of August this year. So COVID-19 viruses continue to evolve and it will generate more variants in the future. The only way to actually reduce this is to reduce transmission, and that is to achieve a very high vaccination rate to suppress transmission of the virus and therefore decreases the probability of new variants appearing. So do get vaccinated to reduce this transmission as well and to protect your loved ones. Okay, I will now proceed to the antigen rapid test kits. The antigen rapid test kits has been in the news recently. So what the test kit does is that it actually detects the nucleocapsid protein of the SARS-CoV-2 virus. And I'll show you what is this part of the virus that it detects. There are multiple brands in the market. Currently, HSA approves up to 6 different brands of antigen rapid test kits. So this is an example of a brand that's available in the market, the PanBio antigen rapid test by Abbott. These are 2 other brands that you can find, the QuickView as well as the SD biosensor. The concept is the same with very minor differences, maybe in the number of times that you have to twirl the swab or the waiting time to read a result. But the concept is actually the same. So this is a picture of the SARS-CoV-2 virus. So the antigen rapid test actually detects the nucleocapsid protein, which is in a red box. Yeah, it's a component of the SARS-CoV-2 virus, and this is the antigen that it detects. Hence, it's named as an ART, antigen rapid test. Rapid because the results can actually be read in around 30 minutes or less than that. Okay, so now we'll just proceed to watch a short video. Actually, it's from CNA on the inner workings of the antigen rapid test. So I will just share the video.
So this is an antigen rapid test kit, similar to the home test kits you might buy off the shelf in a pharmacy. I want to find out everything you need to know about these self-swabbing test kits.
What happens in between is the color of the paper changes if these plugs are present in that fluid. It will light up as a colored line at the test T mark in the reading window.
From the point we're exposed to COVID-19, it takes up to 14 days for symptoms to show. The viral load is the highest, between days 5 to 7. This is when you are most infectious. Anything outside of that 2-day infection window, where the viral load is highest, the self-swabbing kits have a higher chance of false positive and false negative results. A false positive result means that a person is wrongly diagnosed as infected, whereas a false negative means a true infection is missed. An inaccurate result could happen because of two scenarios. One, you are testing outside your most infectious period. Or two, the result of improper sample collection, such as contaminating your swab sample.
It's important to follow the manufacturer's instructions because some of the test kits are a little bit different, but this is what we do for this one. So the first thing she's doing is washing her hands, and we want to make sure everything on the specimen is actually from her nose. It's important to go in 2 centimeters, do the 10 swirls in each nostril. So now she's opening the solution, which is where she'll put the specimen. And again, it's another 10 swirls. She's just squeezing a little bit, not too hard, but just enough to really try and get off as much material as she can from that swab.
Is that squeezing really important? Because do some people just dip it and just...
That's a common mistake for people doing it on their own. And obviously, if there's virus there, we want to get as much of the viral particles into the solution as we can. Okay, so now she's going to drip it into the machine, if you like. You have to put it in the small dot.
I've also seen some people put the drops on that area where the CNT is, directly. I mean, does it make a difference?
Of course, no, that's not how you do the test. So that would be invalid because it has to move along, and it's that movement of the viral material that highlights whether it's a positive test or a negative, and that's why it's important to do everything well.
Okay, so I hope you have enjoyed that video. Basically, it's very important to follow the manufacturer's advice for each individual test kit. Also to ensure that you swab it correctly. As you can see in the video, if you do not actually put the swab into your nose, you're going to get a negative result. So don't put it near your nose. You actually have to put 2 cm into your nostril and to twirl it according to that recommended by the manufacturer. So this could be 5 times, it could be 10 times depending on your test kit. Okay, there are 2 important things that I would like to highlight when doing your ART test kit. That is, you should actually wait the stipulated amount of time as per your manufacturer, which is usually around 15 to 20 minutes before reading the results. If you read the results too fast, let's say like just in a few minutes, you might actually get a negative result. And this is because there's not enough time for the antigen in the SARS-CoV-2 virus to actually show up on the test strip. So you actually do have to wait for that recommended time period before reading your result. Don't rush it. All right. Okay. I have an example over here. If you can see, this is an example of an antigen rapid test. All right. So you can see that there are some, if you are tested positive, there'll be two lines. One is at the C. C means control, and another is at the T, which is the test. So if there's a line that appears on the test part, this would indicate that you are positive because the antigen of the SARS-CoV-2 virus is actually detected. For this current set of results, it's a negative result where only the control line is present, but there is no line on the test part. Okay, there could also be another result that is an invalid result. An invalid result means the control, which is a C, does not have a line. In this case, you should actually disregard the test because this is invalid. There could be a problem with the test kit, or there could be some other issues with how you store the test kit, which leads to this invalid result. So you should disregard the test and repeat the test with another test kit. Okay. All right, this part is a bit technical, so I'll try to explain. So just know that the antigen rapid test is not 100% accurate. Therefore, there are instances where you will need to confirm with the gold standard, and the gold standard is actually a PCR test. A PCR test, you can only do it in the clinic, where they will actually go quite deep in. Maybe some of you have done that. And it is actually a genetic test to detect the genetic material instead of the antigen material of the virus. Okay, so in every diagnostic test, for example, here I just pull out the two brands that we have in the market. There's something called sensitivity and specificity, and these values will determine false positives and false negatives. So if you have seen in the video, a false positive basically happens if the test tells you that you have COVID-19 when you actually do not have it. And the false positive, how high it is, depends on the specificity. If the specificity is very high, this means the chance for a false positive is actually low. And we can see that for the test kits, actually the specificity is quite high. Whereas a chance of a false negative, it means that the test tells you it fails to pick up COVID-19. So meaning it tells you that you do not have COVID-19 when you actually have it. And that will depend on the sensitivity. The higher the sensitivity, the less chance it is to have a false negative. So this sensitivity value changes depending on the viral load. If you can see in the video, you are most infectious between day 5 to day 7. So over here, there's something called CT. CT is actually the cycle threshold. It indicates your viral load. So for a lower cycle threshold, it means that you have a higher viral load in your nose. So as you can see that in a lower cycle threshold, which means the higher viral load, the sensitivity actually increases. And it can increase from 90% all the way to 97%. So it is very important to bear in mind that the antigen rapid test is not 100% accurate. If in doubt, you should always do a PCR test, the gold standard, to verify. The antigen rapid test is useful because it can provide immediate results and it's quite easy to use. But if you have any doubts on the antigen rapid test, please do see your GP to get a PCR test. All right. Okay. So MOH in the recent days have released advisories on what to do if you do an antigen rapid test and it's actually positive. So some people may not have any symptoms, but the antigen rapid test is positive. These are asymptomatic carriers. So it still means that you do have COVID, just that you're not experiencing symptoms. Maybe you're very young or you have you are vaccinated. But you still should not go to work and you should not engage in social activities. Do not go to the emergency department because, I mean, there's no point. And you might even end up contracting COVID-19 from the emergency department. If you are worried, please go to a swab and send home clinic, a SASH clinic or your GP clinic, and the doctor will advise you. You should self-isolate for 3 days, 72 hours, repeat the ART test after 3 days. If you are negative, you can then progressively resume your activities. But if you are still positive after 3 days, you may choose to consult a doctor. All right. Okay, these are certain FAQs on the home recovery program recently started by MOH. So the first on the left, this is what I've explained earlier. If you are positive on the antigen rapid test, but you do not have any symptoms, you just need to self-isolate at home for 3 days and repeat the test after 3 days. Okay. On the right side, you can see that if you test positive on the antigen rapid test, when should you get a confirmatory PCR test or the gold standard? You do not need to do this unless if you are, of course, sick with upper respiratory tract infection, like fever, symptoms like fever, cough, flu, or runny nose, then you should proceed to see your GP. Or if you're under home quarantine order, stay home notice, or health risk warning, you should still get a PCR test. If you are a healthcare worker or elder care worker, you are in preschool, you teach in primary school or study in primary school, or you are aged above 80 years old, if you are vaccinated, or above 70 years old, if you are unvaccinated, you should proceed to your GP to get a confirmatory PCR test, because the ART test is not 100%, and you might need follow-up treatment. Okay, so if your antigen rapid test before 72 hours is negative, you should still isolate yourself up to that period of 3 days before repeating your test. Only then at the 3-day mark, if it's negative, then you may safely and progressively resume your social activities. Okay, so if you're under home recovery, do take some precautions to protect your other household members. You should stay in a separate room, preferably with a attached bathroom. Again, practice good hygiene. You should open the windows to ensure that the house is well ventilated. All right. Yeah. So if you run out of ART test kits, which is number 6, basically, if you're at home recovery, you need to get someone else to get the ART kits for you, or you can actually purchase it online. Okay. And if you stay with other vulnerable seniors and in the same household, it is important that you self-isolate and reduce contact. And if you need to step out of your room, you should always wear a mask. Okay, this is just a quick one slide on the oximeter. We know that each household has actually received an oximeter. So what is an oximeter? It basically detects the amount of oxygen you have in the blood, and this is something important for you to know when you're at the home recovery. So what is considered a normal oxygen saturation reading using the oximeter? So the oximeter determines the oxygen saturation. A normal reading will be between 95 to 100%. If you do notice your oximeter reading drops below 95, that means from 94% onwards, this means that you actually have low oxygen saturation in the blood. And it will be good to actually consult a doctor, either through telemedicine, if you're on the home recovery program, to ask on what is the next step to do. Okay, so the oximeter actually, how does it measure this is it uses light. So there's a red light and infrared light, and the detection depends on the amount of light that's being absorbed by a fully oxygenated blood or less oxygenated blood. They actually absorb different amounts of these lights, and the differences will then tell you the results of your oxygen saturation in terms of percentage. Okay, so I hope you have a brief understanding of how the oximeter works and when to seek medical attention. All right, I think that's the end of the presentation. I'll look through some of the questions that you have, and I'll address it one by one.
Okay, thank you, Mr. Chia, for the insightful sharing. We'll be having a short 3 minutes break, so you can take this time to type your questions into the Q&A box, and Mr. Chia will address them shortly after the break. Thank you. Hello, thank you everyone for staying with us. So Mr. Chia will now proceed to the Q&A session. Thank you.
Hi, I've seen the questions. I will try to address to the best of my capabilities. But some of the questions I mean, those that I don't really know, I will tell you that I don't really know. Okay, so I'll just take the first question. One of the participants say that she has taken the first Pfizer jab and therefore experienced rash and allergy and was advised to use an alternative such as Sinovac, and would like to know if Sinopharm is similar to Sinovac. Should she choose to go and take Sinopharm? So Sinopharm and Sinovac, they are both inactivated vaccines. So in the sense that it's similar, but they are made by different companies. However, the way they work is similar. They are inactivated vaccines, and it's also 2 doses. So you can choose to take the Sinopharm vaccine if you do not want to take the Sinovac vaccine. Okay, I hope that answers your question. Another question, are we infectious when we are vaccinated? Or can vaccines shorten the infectious time frame compared to unvaccinated people? So the vaccines will not give you the COVID infection. So you are definitely not infectious when you're vaccinated with a vaccine. Full vaccination or complete vaccination has been shortened and has been shown to actually reduce viral load and also improve recovery time. So yes, you are right. It can shorten your infectious timing compared to unvaccinated people should you contract COVID-19 after immunization, after vaccination, sorry. Okay, where can I take a PCR test? So a PCR test can only, a PCR test can be taken at a clinic, a swab and send home clinic. It can be taken at your GP. It can be taken at a health facility. So any of these, or even the regional swab centers that's set up by the government, you can actually take a PCR test there as well. Yeah, so for the complete list of where you can take a PCR test, you can actually refer to the MOH website. Basically, it's almost every GP clinic. All right. Okay. Is it necessary to obtain an oximeter? It would be good to have. It wouldn't be an absolute necessity. Of course, with the oximeter, what it does is that it's able to measure the oxygen saturation in the blood. And it will tell you when your oxygen saturation is low. So it will be a good to have an oximeter. Having said that, I believe that every household should have received their oximeter by now. But if you want to purchase it, it's available at any pharmacies. Okay, there's another question here on whether the community cases, will it drop soon? Why are there so many cases when so many people are already vaccinated? Okay, of course, I do hope that the community cases will drop soon, because as we know that we will try everything we can to manage the cases. It will be very good if the community cases start dropping. So everyone has to play your part in reducing interaction, and hopefully we'll pull through this, and we'll start to see cases dropping soon. As to why there's so much, as to why there's still infection even with a high proportion of vaccination, we need to remember that the vaccines were initially designed against the original strain of SARS-CoV-2, the original strain of COVID-19. Likely the community transmission right now is caused by the Delta variant, which is slightly different from the original strain. So the effectiveness against infection would have dropped because you are designing something against the original virus, but right now it's not exactly the original. So we would expect the effectiveness against infection to drop. However, what is very important is that it still protects you sufficiently well against severe disease. So that's why we are seeing this transmission. And besides that, the Delta variant is also a very highly transmissible variant. It's a variant of concern. There have been reports saying that the reproductive number mimics that of chickenpox. So if you know chickenpox is a very infectious disease, and Delta variant can spread like chickenpox, and therefore it does result in very high numbers in the community. And it's not a perfect match for the vaccines. Therefore, we do expect to see people being infected. Okay. I had 2 jabs of the Sinovac vaccine. For booster, can I take Pfizer or Moderna? I don't really have an answer for this question right now. Currently, the booster jabs are the Pfizer or Moderna jabs. So basically, if you receive the SMS, you should, if you receive the SMS from MOH to receive the booster shot, you should go and take the booster shot. There have been studies on mixing vaccines. So for example, there have been studies overseas that you take the first jab of AstraZeneca and the second jab of a Pfizer vaccine. It might actually help to boost the antibody levels better. So this is, there have been studies on this, and it's called the heterologous prime boost vaccination strategy. However, to answer conclusively, actually, I think we need more data currently on which booster is better. I do not know at this point in time. Okay. If I have a low viral load, can I still pass the infection to other people? Yes, you may, but less likely. Because if you have low viral load, it means there's less shedding, and therefore you're less likely to pass to others. Okay, but you can still infect others. Okay, could you show the full slide on variants of concern? Okay, is there any reason that you want me to show the full slides on the variants of concern? There are currently 4 variants. Okay, I think it's a slide after that. Yeah, there are currently 4 variants that is officially recognized as variants of concern. But the one that is very, very transmissible right now and the one that's relevant to Singapore is actually the Delta variant. Okay, there are other questions. Can one take the booster jab if he or she experiences chest tightness, or I think it's blood pressure for a few weeks and swelling in eyelid for a few hours after the second dose of Pfizer? Okay, this would be, this sounds to me like an allergic reaction. Yeah, allergic reaction. So I would recommend that if you were to take the booster shot, you will need to, for this, you need to consult a doctor, all right? Because it seems to me that it's an allergic reaction. Having said that, there is actually a 30-minute observation period after the vaccination to catch all these allergic reactions. However, I cannot answer specifically for this case because we have to look at every individual patient's case. So in this case, the best person to ask would be your doctor or at the vaccination center where doctors will be available to see whether you can proceed with the vaccination. All right. Okay. I think there's another one. Currently under MOH's dedicated public health program, only Sinovac is being offered to those who are not suitable for mRNA vaccinations. Any reason why Sinopharm was not offered under the program? I do not know this because I'm not. I'm not from MOH. It could be a matter of time where they are actually finalizing things to include it into as an alternative vaccine, but I really do not know. Okay. Can the booster jab different from the first and second dose? For now, the booster jabs recommended are actually the Pfizer or the Moderna vaccines. Okay. Okay. Are there other things I can do to improve the effectiveness of the vaccinations? Well, I don't think anything that you can specifically do to increase the effectiveness of the vaccinations. Of course, a healthy immune system will do well to improve effectiveness of vaccination. So what you can do is actually to keep yourself healthy. taking a balanced diet, still do your exercise, okay? And also control your stress level. Yeah, try to reduce stress. I think these things will actually keep your immune system healthy. So when you actually eventually do receive the vaccine, your immune system will react to the vaccine and it will mount a much stronger immune response. Okay, but having said that, the beauty of the mRNA vaccine is that you are actually able to modify the mRNA according to the spike protein that you want. So it is possible in the future that the mRNA vaccine can be modified to the Delta variant, and that will greatly improve the effectiveness of the vaccine, because then it will be a better match to the current circulating strain. Okay, the government is encouraging 60-year-old and above to take the booster shot. Is it because their immune system is weaker? Can I take them even though I'm below that age? So for now, the age has actually been reduced to 50 years old. So if you're 50 years old and above and you have received the SMS from MOH, you should take the booster shot. On whether the immune system is weaker, generally the elderly will tend to mount a weaker immune response. But having said that, it's still sufficient to prevent severe disease or hospitalization. There is also vaccine. The vaccine may also wane with time. We know that the immunity doesn't last forever. It's just that we do not know how long it will last. And studies have shown that there is slight waning in the vaccine efficacy. So in order to give better protection to the elderly who are at the at-risk group, a booster shot is recommended. Okay. May I know the booster jet? Pfizer and Moderna combined. It will be either one. You can't really combine the vaccines. Okay, so it's either the Pfizer or the Moderna. Why are COVID positive people allowed to leave home after their QO period, even though they still have the virus? So a QO is not issued to someone who has COVID positive. A QO is actually issued to the close contacts of a COVID positive patient. And if you have passed the period of the QO, it means you are past the incubation period of the virus. And if you're still tested negative at the end of the QO, this means that you do not have the virus. You are definitely allowed to leave your house. For those who are COVID positive, for right now, the criteria has been revised. Those under the home recovery program, after 10 days, after 10 days, if you are well, you are discharged from the home recovery program. So that's for COVID positive patients right now. Okay, all right. How often should we take an ART test? Okay, if you are symptomatic, if you have runny nose, sore throat, upper respiratory tract infection symptoms, I would highly recommend you to take an ART test because that will then tell you whether the symptoms may be due to COVID infection. There are some cases where you are part of maybe F&B or as a part of work that will require you to take regular ART tests. So you should follow the instructions and recommendations from your employer as well on when to take the ART test. By taking the ART test regularly, even though you are not symptomatic, we can actually detect asymptomatic infection. And that, as we know, COVID-19 can still spread even though you have no symptoms. So if we do an ART test regularly, we'll be able to pick up these infections and self-isolate so as to reduce the spread. Yeah, okay, I think I have one last question. In my case, I was put under special program. Okay, Okay, so this is again about switching to a non-mRNA-based vaccine because of an allergic reaction to the Pfizer shot. Yes, you can proceed to actually take the Sinopharm vaccine. It's similar to the Sinovac vaccine. Okay, so the Sinopharm and the Sinovac vaccines are alternatives if you do develop allergy to mRNA-based vaccine. So you can proceed to take it. And if you choose to take it earlier, you can. They are almost the same. Yeah. Can the Sinopharm vaccine be boosters for seniors who are fully vaccinated with the Pfizer vaccine? Okay. Currently, that's not the recommendation by. Actually, to be honest, for this answer, I do not really know, because I do not know of any published data on on antibody levels after fully vaccination with Pfizer vaccine and taking the Sinovac vaccine after. We do not really know, but like I said, there have been studies of mixing vaccines, AstraZeneca and Pfizer, but I'm not really sure about any studies mixing between Sinovac and Pfizer. Yeah. I come across friends who are tested negative but still need quarantine for 10 days. Then they are counted as infected. Okay. Well, do you mean that they are actually close contacts of positive cases? If they are close contacts of positive cases, then yes, they will need to be under quarantine as well. So I think that is the likely scenario for your friends. Yeah. Okay, there are more questions coming in. Okay, there's a question on this participant who has received 2 doses of Pfizer BioNTech COVID vaccine, and which type of booster would you highly recommend, Pfizer or Moderna? Well, they are both mRNA vaccines, so there shouldn't be a difference on whichever one you receive. Okay, it's actually whichever one that is available, you should go for it. Okay. Since mRNA vaccines are relatively new, are there any known ill long-term effects from taking them, and also so many within a year? So as we now have sufficient data and a sufficient number of people vaccinated to actually carefully analyze mRNA vaccine side effects. So for Singapore, the Health Sciences Authority, HSA, do monitor very closely for any adverse effects or any side effects from the vaccines, and will issue advisory as appropriate. So right now, the mRNA vaccines are very safe. Common side effects that we know of include injection site reactions, which means redness, swelling, or pain at the injection site. You might get fever, you might get malaise, you might get muscle aches. These are the more common ones. But this is also a manifestation that your immune system is actually reacting to the vaccine. And it might actually be good to have such reaction. It shows that the immune system is actually working to protect you. Okay, but there are some people who develop allergic reactions. For example, rash, eye swelling, difficulty breathing. These are allergic reactions to the vaccines. In terms of very serious side effect of mRNA vaccines, so far, the one that we have been able to detect would be the myocarditis and the pericarditis. This is more common. It's still very rare, okay, very rare, but the risk will be higher in young males below the age of 30 years old. And therefore, there is this advisory to actually avoid strenuous physical activity and to monitor yourself for 2 weeks post-mRNA vaccination. But it's very rare, so rare such that actually in the initial clinical trials, myocarditis was not flagged out as a possible side effect. It was only when we administer to more in the population that we are able to detect this side effect. Yeah. Some people do not have the capability to produce COVID-19 antibodies. How do we know if we do have the required antibodies? So, well, we can actually test antibody levels, but this test is not, I don't think it's usually done just like that. I mean, your doctor can actually request to test for your COVID-19 antibodies. However, it's important to bear in mind that currently we do not know what is the cutoff for antibody protection. So I do not know at what level of antibody in your blood that you will be sufficiently protected against COVID-19. So although we can test, but if we do not know the cutoff, I don't think there is any point in testing. But having said that, almost everyone will have sufficient antibodies, unless if you are immunocompromised or you are in the very elderly group. Yeah. Why are women more prone to long COVID-19? I frankly do not know the answer to this one. It's just an observation. There's a lot of things that we do not know about long COVID, but from observation, it's actually what we observe, or what the community has observed, or the scientists have observed, is that women are more prone to long COVID, as well as increased age. And if you did not take the vaccine, so if you are unvaccinated, you are also more prone to develop long COVID. Yeah, so the point is to actually take the vaccine to reduce your chances of getting long COVID. Yeah. Okay, thank you all for your questions. And I hope you have learned something. If you have any further questions, you may actually email in. All right.
Yeah, so thank you once again to Mr. Chia for the insightful sharing. Yeah, and thank you for answering all the questions from our participants. So thank you to all of you who have joined us for this session today as well. And we have come to the end of our Zoom webinar session. But before you go, we have some announcements for you. So as a reminder, this webinar is recorded. So if you would like to revisit the information that you have that has been shared during the session today, you can look out for the video after our event on our TTSH Health Library and TTSH YouTube channel. Please allow us some time after today's session to upload the video. So the first announcement will be regarding our upcoming health talk that will be happening on 1st October, this coming Friday, titled Healthy Aging Starts With Me. So you may sign up for this link. You may sign up for this talk by, so we will send in the registration link to this later on. So you can sign up for it if you would like to join for this webinar. And secondly, could you please help us fill in the feedback form via the QR code shown on the screen? You may leave the webinar after filling in the feedback form. And your feedback is really important to us, so we would like to hear from you as well. So thank you once again for joining us today, and we hope that you keep healthy and stay safe. Thank you.